Good afternoon, and thank you for joining us. Today is Tuesday, November 23rd, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and Milwaukee County Executive, we'll hand things over to you today.
Well, thank you so much, Catherine, and good afternoon to everybody. It is nice to see you all joining us again. I know it's been a while for me, but before I get started, in light of the recent violence during the downtown Waukesha Christmas parade, I wanted to take a moment to say that our thoughts and prayers continue to be with our neighbors from the Waukesha community and everyone who was affected by this senseless tragedy. I want to say thank you to the Milwaukee County Sheriff's Office for providing some support to our neighboring county and to all the first responders who cared for the victims as well as their families. And through these trying times, it is not uncommon to experience emotions of anger or confusion or distress. So please know that you are not alone, but there are resources that can help. And so our Milwaukee County 24-hour crisis line is staffed by clinicians and ready to listen as well as provide resources. So please call 414-257-7222. Again, that number is 414-257-7222 for any assistance. It is free to call, and we have staff standing by to help you or someone you know. So if you're looking for ways to help the Waukesha community and the victims as well as their families, there are a few ways that you can help to donate. The Waukesha County Community Foundation and the United Way of Greater Milwaukee and Waukesha County have partnered to create the United for Waukesha Community Fund. And the money raised will help families that have been impacted by Sunday's evening's horrific events. But Varsity Blood Center of Wisconsin is also extending its hours at Metro Milwaukee donation centers and are looking for donations of all blood types, but particularly type O positive and O negative are in the most demand. And there are also several GoFundMe accounts created for the victims as well as families and some local organizations that have been affected by Sunday evening's tragedy. And so let us all remember to keep these community members in our thoughts, especially as we enter the holiday season. So thank you for that. But I also want to transition now to talk about COVID-19 updates in our community. And so as we look at the COVID-19 disease burden in Milwaukee County and the state as a whole, we've continued to see a rise over the last few weeks. And this is a trend that we're watching and closely, particularly in Europe and other countries. And as we head into the holidays and into the cooler months, it's really important to get the COVID-19 vaccine for yourself as well as your family. So if you have any kids 5 or older, they are eligible. And as many of us know, the vaccine is the most effective tool that we have in really fighting this pandemic. And I know we're all anxious to resume activities like family gatherings like we did pre-pandemic, but we have to increase our community vaccination rate to really overcome the increased disease burden. And so I want to emphasize that first and foremost, getting vaccinated is the most important step. But this past Friday, the FDA authorized both Pfizer and Moderna COVID-19 boosters for all adults ages 18 or older. So if it's been at least 6 months since you were vaccinated, you can now go get your booster shot. And you can visit healthymke.com to find a location near you, whether it's the vaccine or the booster shot, they are free. And our Milwaukee Health Department, City of Milwaukee Health Department locations do not require any type of appointment. And so given the holidays, make sure to check the healthymke.com website for updated hours this week. And while you are getting vaccinated or getting your booster shot, please remember to get your flu shot as well if you haven't done so. The CDC states that the COVID-19 and flu vaccines are both safe to be administered at the same time. And so the cooler temperatures, they're here with us, and we want to keep everyone safe and healthy this winter. And so, while we talk about COVID-19's vaccinations continue to roll out, particularly for people worldwide, I want to touch on a different vulnerable group that recently received a shot within Milwaukee County. And so the Milwaukee County Zoo's animal care team began vaccinating their high-risk animals for protection from the COVID-19 disease. And so some of the animals receiving the vaccines are apes or primates, are big cats or North American river otters. And so the animals will receive a similar regimen of COVID-19 vaccines that we have received as humans, meaning that you're getting about 2 doses, about 3 weeks apart, and they will be monitored by animal care staff for any side effects. And so we're really happy to report that there have been no reported adverse effects at this time. And so I want to say thank you again for joining us this afternoon. And I'd like to hand it over to Mayor Tom Barrett. Mayor Barrett.
Thank you very much, Mr. County Executive. And like the County Executive, I want to extend my condolences to our neighbors affected by the tragedy in Waukesha. It was a horrific, horrific incident, and it adds a sadness to this Thanksgiving season. I'm a longtime fan of the Dancing Grannies, and to see that wonderful civic group with those talented individuals so tragically affected is heartbreaking, as well as the young children that were and teenagers that were marching through that parade. It was unbelievable to see what was happening. And so our prayers are with the families and everyone in Waukesha today. This is when we need to come together after we see something like this. So a very, very bad day for Waukesha, a bad day for all of Wisconsin, and really for people who care about decency in our society. I will also turn to the COVID issue. We remain in the extreme transmission category for COVID-19 cases per 100,000. We're at 205 cases per 100,000, and that number is up once again from last week. This is not the trend that we want to see, particularly going into the holidays. But again, we are seeing an increase in the transmission, and we remain in the extreme transmission category. And our percent positivity rate remains in the moderate transmission category at 7.5%. So it continues to be a serious issue. We are continuing to see more hospitalizations and deaths, and that's something we want to avoid. Again, particularly as we get into this period of year when we want to be with our loved ones and our friends, but we want people to be safe. On the bright side, we are seeing more people getting vaccinated. We're just a tad under 60% for the city of Milwaukee adults. We're at 59.6%. Individuals 16 or older are fully vaccinated. Let's get that over 60%. We can do that. We can get even higher, I hope, as we get closer to the holidays. 64.6% of adults have received at least one dose. And if you're looking for something to talk about at Thanksgiving gatherings, we know that Thanksgiving brings families together, and it's a good time to have respectful discussions about vaccination, Health experts agree. Vaccinations improve your safety. Vaccinations improve your family's safety, and vaccinations improve the community's safety. That continues to be reinforced as we learn more about the vaccine. For those looking for first, second, or booster shots of the COVID-19 vaccine, and more people will be looking for those with the decision to have all adults eligible for that booster shot, we're ready for you. We are absolutely ready for you at our city clinics. There are opportunities not only in our clinics, but throughout the community. Today at Benjamin Franklin Elementary School at 308 West Nash Street from 1 to 4 p.m. At St. Anthony's on the south side, 1730 South 9th Street from 3 to 6 p.m. Tomorrow, the day before Thanksgiving, in addition to the health department's 3 community sites, we'll be at Summerfield United Methodist Church from 11:30 a.m. to 2 p.m. We'll be at Ascension All Saints Family Health Center from 1 to 4 p.m. And we'll be at Children's Outing Association, COA Golden Center from 3 to 5 p.m. As I mentioned, and as the county executive mentioned, the FDA and CDC recently announced that all adults are now eligible for the COVID-19 booster shot. So receive your booster and enjoy the holiday season knowing you have the highest level of protection against the virus. We know that the process is very quick. We are not seeing long lines right now, and our teams are eager to get people vaccinated before the upcoming holiday. My wife got her booster on Saturday. One of my daughters got hers today. So join the Barretts in getting those booster shots. I'd also like to turn to what we're doing for our employees, because our employees have done such an incredible amount of work over the last year and a half. And with Thanksgiving just a few days away, there's a temporary change in our clinic hours. The city of Milwaukee's Northwest, Southside, and Menominee Valley community locations for testing COVID-19 vaccine and flu shots will be closed Thursday, November 25th through Sunday, November 29th, in observance of the holiday, and to give our hardworking employees a chance to breathe. Please visit healthymke.com for other available testing or vaccine locations during this time. Today, the Milwaukee Health Department will conclude its first round of vaccines, at its school-based locations in partnership with Milwaukee Public Schools and private schools, including the Seton Catholic Schools. This has been a great partnership, and I want to publicly thank the superintendent and the leadership in the schools for working with us to get the kids vaccinated. These clinics were offered daily beginning on November 8th, and about 1,000 vaccinations were provided, and most of those went to students. We'd like to see even more, but those are our starting numbers. Beginning November 29th, the same cycle of 22 schools will repeat to administer second doses, although first doses will still be available to the public at these locations as needed. This schedule will allow 10 days after the second dose, prior to the Christmas holiday, and 2 weeks before the New Year's holiday, for children to reach their full immune response and be fully vaccinated by the holidays. So we want people to be safe on Thanksgiving and throughout all the holidays in December. So have a safe and happy Thanksgiving, everyone. And with that, I'll turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we are currently seeing in Milwaukee County an average of 267 new cases per day and about 3 deaths per day. Our trends have overall been quite poor. When it comes to COVID, we're not even close to out of the woods. We are deep in the woods. Wisconsin is the 6th worst state in the country in cases per population. We have more cases per day than at any other point that we've seen in 2021. And if you prefer to measure hospitalizations more than cases, we also have more people hospitalized with COVID than at any other point in 2021. And both of those numbers are rising. The bottom line is that we do not have enough people vaccinated. We'll come back to that in a moment. But first, I wanted to take a moment to recognize the tragedy that took place in our neighboring Waukesha. Both the lives lost as well as the adults and many children that remain hospitalized, but also the families affected not by injury, but by proximity to such a horrific event. And to the first responders from all around our region who arrived on scene and provided life-saving care to so many. We expect our first responders to be brave and to be trained to run into the chaos and provide care. But in the many videos that have circulated, we certainly saw that chaos. But in each of those videos, we also saw parade goers running toward the victims, into the danger to hold hands and to render care. So as we certainly mourn the loss, we may take some solace in that inherent good that we saw in everyday people. The next few weeks will be hard. They'll be hard with reflections and impacts from that terrible event. They'll be hard with people who are missing from the Thanksgiving table due to loss from tragedies like this, and due to the loss of so many people from COVID. They'll be hard as our cases and our hospitalizations and eventually our deaths continue to rise. And they'll be hard due to exacerbations of depression, anxiety, and other mental health challenges that are inherent around the holidays, particularly holidays like this where gathering may present challenges. As always, reach out. A phone call to grandma or grandpa, a visit to a neighbor, or take the holiday as an opportunity to reach out to that friend or that family member from whom you've grown apart. That relationship that has suffered due to political or ideological differences. We all have them. Use the holiday to take the first step in mending those connections. Now, with Thanksgiving just days away, we'd be remiss not to discuss what you can do to keep your gathering as safe as possible. And your plans are likely already set, but there are still simple steps to not only increase your safety, but increase the safety of everyone around you. First, vaccination. If you're not already vaccinated, get that first dose on board as soon as possible. It can start to give you some level of protection. And that protection will increase through the upcoming holiday season as you see more friends and relatives and neighbors. The same goes for boosters. With the new CDC guidance, booster decisions are much easier. If you're 18 and older and got Moderna or Pfizer more than 6 months ago, get a booster, period. If you got J&J more than 2 months ago, get a booster. The added protection from that booster is substantial, so get it today. Next, testing. You can go out and pick up the relatively cheap, simple, at-home rapid COVID tests. They're a few bucks, and you can have everyone take it the morning before you gather and have that additional layer of safety at your event. There's, of course, ventilation. You can crack a window. If you have a HEPA filter, you can turn one on at your house. Masking, you want to consider masking those who are not yet fully vaccinated. Now, each of these layers adds up to a safer event. Thanksgiving can be a wonderful celebration among family, but you don't want it to be the reason that someone gets sick or gets hospitalized or can't join you for the next gathering. So take home points. We're not out of the woods. These next few weeks will be challenging, so get vaccinated or get boosted and reach out to someone around you in need. Thank you, stay safe, and I'll hand it to Health Officer Roush.
Good afternoon, everyone. It's my pleasure to join today to talk about the COVID data for this week. Go ahead and share my screen here. Echoing what Dr. Weston and others have said, certainly we have seen data continue in the wrong direction. And that's certainly noteworthy as we enter the holiday season. I want to start today by looking nationally and then drilling down into the local area. So on the screen here, you can see risk levels by county, and areas that are red and orange have high levels of transmission. And you can see here that all of Wisconsin is at the highest level of disease transmission at this point. As we drill down a level and look at county data, much as Dr. Weston shared, Wisconsin is one of the leading states in terms of COVID-19 transition. And again, these data change a little bit depending on what site you're looking at, but this is data from the CDC that's showing Wisconsin at very high rates. As we drill down more locally, we know this is where disease has been occurring in Milwaukee County. The areas that are red and orange on this map are also areas of high transmission. What we don't see on this figure is what's happening in the collar counties around us. But they, according to my colleagues, are also having hotspots of disease as we are undergoing a significant increase in cases over the last couple of weeks. When we look at the counties here, it's notable in Wisconsin that we don't have high, medium, or low levels of transmission. We only have critically high and very high. So when we're thinking about Thanksgiving and thinking about traveling, we need to make sure that we're keeping COVID in the back of our mind and following those precautions that Dr. Weston mentioned, and that I'll end my talks on today. So in Milwaukee County, the graph on the screen here is looking at total cases of COVID. And again, we have seen this increase since late October, continuing upward in both the suburban communities and the city of Milwaukee. And when we look at cases of those aged 18 and under, our kids, we're seeing that we're still climbing in kids as well. We're nowhere near where the peak was back in the early parts of the school year, back in mid-September, but we're certainly trending in the wrong direction. And that's something we want to be aware of. As others have mentioned today, deaths in Milwaukee County have remained pretty flat over the last several months, but any death from COVID at this point is very preventable because of the vaccines and other mitigation measures that we have in place or have available to us. We haven't talked about the transmission rate recently, but certainly when we look at this slide and look at that transmission, we are above 1 for our reproductive number, and that is really what is driving cases in our area. And certainly, as an epidemiologist and a public health official, I do have some concerns heading into the Thanksgiving holidays where people have been more prone to gather in families, in groups in the past, and certainly concerned about where we trend in the future weeks. Lastly, as I mentioned, we have a vaccine. So COVID is rapidly becoming a vaccine preventable disease for those who are eligible to receive the vaccine. And we have seen many, many weeks and months of a decline in the total numbers of vaccinations given in Milwaukee County. But we see a nice increase here over the last 3 weeks in green, which is related to the Pfizer vaccine for 5 to 11-year-olds. So we're very excited that this vaccine has been approved by the FDA, approved by the CDC, and approved by the state. And those numbers are beginning to grow quite rapidly. We talked about that on last week's media briefing as well. When we look at this figure, it looks at the percentage of county residents with at least 1 dose of any COVID vaccine. And we've seen for a long time Our adult age groups have been really rapidly increasing, but certainly we reflect down here about 6% of our 5 to 11-year-olds in Milwaukee County have received at least one dose. And most of those, or many of those, will be getting their second dose here in the next couple weeks. So we'll start to see this purple line, or this light purple pink line, show up on the next slide I'm going to show you. Right now we have 0 completed 2 doses, but very, very soon, probably the second week of December, we'll start to show data with young kids 5 to 11 years of age who've completed their vaccination. And I'll end on this slide, or spend a little bit more time on this slide, just to continue to point out, as others have before me, that we are nowhere near 100% vaccination in any of our age groups. And I didn't share data about race and ethnicity and vaccination today, but certainly there are groups that are languishing with vaccinations. We know here the 12 to 15s are still below 50%. So less than 50% of our 12 to 15-year-olds have been fully vaccinated with 2 doses. We have only achieved 50% vaccination with our 16 to 17-year-olds within the last week. And so we know there's more room to continue to boost those vaccination numbers to really prevent future outbreaks and future cases of COVID-19. Lastly, you've certainly heard me talk about the layers of mitigation strategies and the very delicious picture of Swiss cheese as we think of Wisconsin as the cheese state. But this figure and all of the things on the Safer Holiday checklist that is here on the screen and that Dr. Weston mentioned specifically moments ago are key to having a safe and healthy holiday weekend should you choose to gather with friends and loved ones. So with that, I will turn the briefing back to Catherine.
Thank you, Director Rausch. I see several questions in the chat. First, I will direct the COVID questions to our guests, and then I can move to other questions that I'm seeing. And thank you, Dr. Weston and Director Rausch, for answering questions about holiday concerns. So I will jump in with Derek Rose's question from WISN 12. He's wondering, for Dr. Weston or Director Rausch, are you seeing any positive or concerning trends in terms of 5 to 11-year-olds with COVID infections and/or vaccination?
Yeah, so when we look at our younger age groups, the 5 to 11-year-olds have some of the highest positivity rates in the county. So when we break it down in different age groups. So 10 to 14, the positivity rate is nearly 11%. The vaccination rate is also some of the lowest in the county. And those two things tend to go hand in hand, whether you look at countries, states, counties, or age groups within the county. So the key is vaccination. We can drive down that positivity rate by vaccinating anyone who's eligible. So anybody age 5 and older.
Thank you, Dr. Weston. Our next question comes from Emily Fannin with CBS 58. She's wondering, Dr. Weston, can you elaborate on when is the best time to take a COVID test for Thanksgiving gathering? And are at-home test kits the best option? And what other ways can you keep gathering safe this holiday?
So as far as testing, you want really a test that same day. A COVID test is really good for the day that you're taking it. And so if you're doing at-home tests, there's plenty of over-the-counter options. Not to endorse one over the other, but it's a question that comes up all the time. The Binex Now test is easy, it's cheap. I think it's $14 at Walmart. That's about as cheap as you can find it. And that's for 2 tests, is $14. And just do it the morning of your event. And I think you can be pretty comfortable with the result of that test. It's not perfect, but it certainly is an added layer of protection. So put that on top of vaccination of as many people in your group as possible. Put that on top of all the other mitigation measures that you're able to do at your event. But certainly that test the morning of the gathering is going to be really important.
Thank you. Okay, our next question is from Eric Gunn with Wisconsin Examiner. He's wondering, to why have the 12 to 15-year-old vaccinations not increased more? Perhaps, oh, yeah, go ahead, Dr. Weston.
The question, I think, was why have we not seen more of an increase in 12 to 15-year-old vaccinations? we've been seeing an increase. It hasn't been a dramatic increase, but we do see more and more kids in that age group getting vaccinated. One study actually that came out, I believe it was yesterday, was more data released from Pfizer's trial on 12 to 15-year-olds. And they found that in their trial of, I think it was about 2,300 kids, not a single kid in that trial who got the vaccine got symptomatic infection with COVID. So they actually, 4 months out from their second dose, they had 100% efficacy in their trial. So it's just more evidence of why the vaccine is so critical in kids, but specifically in that 12 to 15-year-old age group.
Thank you. Not seeing any other COVID-19 questions right now. We'll jump back up to Derek Rose's question with channel 12. It's for Mayor Barrett. He says, thank you for your comments on Waukesha. What do you make of what Southeast Wisconsin has been through the last 24 months on a national stage? Miller Brewery shooting, February 2020, Jacob Blake and unrest in August 2020, Mayfair Mall shooting, November 2020, a polarizing Kyle Rittenhouse trial ending last week, and Waukesha Christmas Parade Sunday, most of which happened during the pandemic.
Well, tragically, I think what we've witnessed in southeastern Wisconsin is a microcosm of what we're seeing nationally and really around the world. A lot of disturbing events, a lot of unnecessary violence. I think pressures on people in all aspects of their lives, whether it's economic or health or emotional, and it starts taking its toll. So from Kenosha to Waukesha to Wauwatosa to Milwaukee to other communities, we have seen the stress points. And obviously, a number of these events have involved criminal actions, and it's important that those who commit these crimes be prosecuted and imprisoned. So it has been a lot of stress on us. But I'm not someone who just accentuates the negative. I think it's important to realize during the same period, we had the first NBA title we've had in this community in 50 years. And so I am heartbroken by the events in Waukesha. We've lit up the outside of City Hall in blue in support of Waukesha. A lot of buildings in downtown Milwaukee have been or will be lit up in support of Waukesha. So we want to be supportive, and we should be upset. We should be angry about the events that occurred in Waukesha on Sunday. But we should also look at the good events that occur. And that's what one of the things that I try to do is accentuate the positive. And I'm hopeful that during this holiday week, that many families will be able to be together. And this will lower our community collective blood pressure by spending time with our loved ones and really reconnecting at that human level, which is, I think, what we all need to do. So let's do it. Let's do it safely.
Thank you, Mayor Barrett. Those are all of the questions that I'm seeing in the chat at this time. So thank you all for joining us, and we will see you next week. Enjoy your holiday week.
Thanks, everybody.
Thank you.